Hello.
Hi, hello. I'm excited to be coming to you live with my colleague, Amy Friedrich Karnick. It is National Immunization Awareness Month, and we're here to tell you about a webinar that we're hosting next week. As always, our goal here at Women Heart is to help you stay heart healthy. We want women with heart disease and those living with risk factors like high cholesterol, hypertension, and diabetes to be aware of how they can take steps to be heart healthy and avoid getting sick. And being up to date on your vaccines is one of those really important steps. So, Amy, what can you tell us about this Awareness Month?
Yes, hi everyone. It's so excited to be here live. As Selena mentioned, it is National Immunization Awareness Month, as designated by the CDC. And really, the point of this month is to make everyone aware of the immunizations that they should have and be up to date so that you can avoid preventable diseases. And that includes people of all ages. So, we've spent a lot of time over the last couple of years talking about vaccines. We talk about the COVID vaccine. We talk about immunizations for children. People are really, they think about new babies, they think about children going off to school and what do those vaccine schedules look like. And you might be thinking about immunization schedules for older adults over 65 because there's no routine of those types of vaccines that folks need to take. This webinar that we're excited to host next week is really going to focus on women living with heart disease, including those under 65 years old, and what vaccines they should be taking and what you should be thinking about. Because women with heart disease are more susceptible to vaccine preventable illnesses, and we want to avoid those. So we're going to be talking about flu season. We will obviously talk about COVID, but we're also going to talk about things like pneumococcal or pneumonia and shingles, and really just make folks aware of what they should know so they can be up to date with all of their vaccines.
That's a lot. And so we're really excited that next week's webinar will feature one of Women Heart's favorite doctors, Dr. Martha Galati, to share exactly what women with heart disease need to know about heart disease, all things heart disease and vaccine. She's a leading preventive cardiologist and associate director at the Barbara Streisand Women's Health Center at Cedars-Sinai in Los Angeles, my hometown. And she's also on Women Heart Scientific Advisory Council, and we're very lucky to have her. In addition, we want to spend some time on the webinar speaking about health equity and what it means to have access to vaccines. Unfortunately, adult vaccination rates in the U.S. remain low, and this is particularly true for women, for people of color, and for those who are under the age of 65, but with high risk factors like heart disease. In some communities, less than a fourth of those who qualify are fully vaccinated. And we understand that there are barriers such as lack of awareness, affordability, and access to care that all impact this statistic, which is why we will be talking about policy solutions on the webinar. Amy, I know we've had a few policy wins lately, but can you tell us about a specific one?
Sure, yes. It is exciting, as you just mentioned. Women Heart has been engaged for many years with several partner organizations and a coalition of groups that have been fighting for policies that would address some of the barriers that you mentioned, things like affordability, information, and really knowing about how to get and when to get the vaccines that we need. So we've been pushing bills that would address some of those barriers. And last week, when Congress passed a huge piece of legislation that you may be familiar with, the Inflation Reduction Act, that bill included many healthcare policies, including those related to vaccines and some of the bills that we've been pushing. So once this bill gets implemented, what it really will do is remove that cost barrier to vaccines that are recommended for adults who get their insurance through Medicare or Medicaid. So there are still some vaccines that folks have to pay a little bit of out-of-pocket cost for. And we know that when there's a cost associated with some of these preventive care measures, folks are less likely to take them up. So by removing that cost barrier, we're really hopeful that more folks, including women with heart disease, will have those access to, and as well as information. There's provisions in the legislation that would increase information and awareness for folks about what they should be doing. So after many years of fighting, those are some big wins. And so we're excited to have Abby Bonus will be on the call as well with Dr. Galati next week and you. She's the co-manager of the Adult Vaccine Access Coalition, of which we're part of. And so she's going to be talking a little bit more about the disparities in vaccine rates. She's going to talk about the barriers, but also some of these policy solutions. So she'll talk a little bit more about that win. But I think that the COVID vaccine and the conversation we've had over the last couple of years, I think has really pointed out some of the shortfalls in our vaccine infrastructure in this country. And so that creates a lot of opportunities for improvement. We know now, especially acutely, how important it is for folks to be fully vaccinated and how much healthier our communities can be when we do have those vaccines. So she's going to talk about some of those policy opportunities, as well as just really why it's important for patient advocates to engage in this advocacy work, which is something we obviously prioritize here at Women Heart. So we're excited to have Abby join us as well to talk about all of that. And for all of us to learn a little bit more about how we can educate our communities about vaccines, which is why we will end also have rounding out our program will be one of our Women Heart champions also on the webinar.
Always the star of our show anytime we have a webinar. We are so excited to have Bev Thompson, who has been a champion with Women Heart since 2012. She's in Texas, and Bev has been engaged as an advocate for vaccination. She also happens to be one of our district leaders. So she knows, not only does she know Women Heart very well, but she knows the area of women and heart disease extremely well. She's going to share with us why it's important for her to spread the word to her heart sisters and to use her voice to speak up for better information and access to vaccines for all. So that is, believe me when I say that she is going to be, a really important source of information in terms of how in practice vaccinations help women with heart disease. So before we sign off, Amy, why don't you tell everyone how they can tune into the webinar?
Yes. So the webinar is going to be hosted over Zoom. You can sign up for free at womenheart.org/webinars. It's going to take place next Tuesday, August 23rd at 1 p.m. Eastern or 10 a.m. Pacific time. And so we hope you'll tune in. You'll be able to write in questions and live chat with our speakers in that time. If you are unable to make it at that time, we will be recording it and the webinar will be available after the fact on Women Heart's YouTube channel. So pay attention to our social media for links. We'll also put a link below here in the chat so you can sign up and look for that recording. I think it's going to be a really useful source of information that will live on for a while to let folks know about how they can stay healthy and vaccinated. So we hope that you'll join us next Tuesday.
Thanks, Amy. And we will hope to see you there. And again, if not, then please catch us on our YouTube channel where this video will live, along with a lot of other great resources. So please sign up. The Heart Talks webinar on preventing illness is next Tuesday, August 23rd. And we hope to see you there. So please go to womenheart.org, and we, again, hope to see all of you there. Great. Thanks.
Thank you.